hereditary angioneuretic edema. So here there's a deficiency of the C1 inhibitor. So the hereditary angioneuretic edema is a autosomal dominant. It is autosomal dominant. Next, if we see the autosomal dominant disorder, that is more common than the complement deficiency states. So it is more common than the complement deficiency states. And there's a deficiency of the C1 inhibitor. It leads to the deficiency of the C1 inhibitor. So what this does is it leads to the unregulated activation of the kallikrein, and this increases the production of the vasoactive peptides such as the bradykinin, and it causes episodes of edema and affecting the skin and the mucosal surfaces. So it affects the skin and the mucosal surfaces, and such as the larynx and the gastrointestinal tract. So it involves the larynx and the GIT as well as the larynx. And next, this may result in the life-threatening asphyxia and the nausea. Leads to the asphyxia as well as the nausea and vomiting and diarrhea, as well as after the minor trauma or the emotional stress. So looking at the other deficiencies, the C1, C2 and C4. If we look at this deficiency, it is nothing but the collagen vascular disorders. Now if you look at the C5 to C8, so what this does is there is a recurrent bacteremia, and this is with the Neisseria.